incarceration alone causes issues with reentry. So unless someone's here overnight, there's going to be some kind of repercussion from being here. If they're here, it's going to cause issues with their relationship. It may be the final straw for family members to kind of be like, I can't support this anymore. You've gone too far. I don't want to deal with it. There's also people lose their housing, people lose their jobs. And so we're also seeing an increase in these things too, because people that may have lost these things due to their substance use, we're also seeing it because of the pandemic. So people may become homeless because they lost their job because of the pandemic. So we have been actively working on kind of addressing these things. When they meet with the mental health clinicians, we do a basic assessment just to kind of plant the seed, like there are things available. There is a shelter across the street. We do have mental health programs of all different levels, whatever you're willing to do. If you want to see a therapist, if you need to see a psychiatrist, if you want to see someone for substance use treatment or just case man, whatever it is. So we kind of try to be the educators of that, to say, listen, these are all the things that are available. They are voluntary. We're not forcing it, but you could probably benefit from it. So in the last 6 months, we've done about 26 referrals to some type of substance use support. We have done 19 referrals to mental health support without substance use. We have done 16 referrals to reentry programs in the community. We have 12 referrals to the shelter, 18 like other types of referrals to other types of programs in the community. And we also have in-house, we do have Bergen Community College works with us, and they have had 247 people in the last 6 months be part of their education program. And we've had 5 people, we're very proud of this, 5 people who have obtained their GED, or now their high school equivalency, while they were incarcerated. So things like that do make a very big difference, because somebody who maybe is not that employable will come here, they will get their high school equivalency, and then they have a much better opportunity, especially now you have incarcerations on your record. So it's just kind of making them more employable. And we try to link to whatever services, whether it's an employment program or something in the community, to kind of say, listen, I'm on your side, I will help you. We know what's available. A lot of people just do not know what's available. And I think that that's a big part of it. And so coming out, when we have people that are Bergen County residents and they don't have any type of employment or benefits, they're homeless, that's especially hard, I think, in Bergen County. Bergen County is a very expensive county to live in, and everything in the county is very expensive. And so I think there's a little bit of stigma added to being homeless in a wealthy county. And so that's part of the problem too. People don't see themselves as somebody who needs to be in a homeless shelter. I don't need that, and I don't think they realize there are so many programs within that shelter that can just help them immensely. So we do try to educate that. As you said, Caitlin, I did work in one of the housing programs at Care Plus that was located in the shelter. So we are able to provide a lot of that information to them and kind of give people, I think, hope that, okay, there is something out there. So maybe I can do something a little bit different, So we do, like I said, there's a lot of these areas that we try to address here. And if I had 50 staff here to address this, I don't think it would be enough, but we do the best we can, and we are working actively on kind of increasing that part of it too.